People and the environment are interconnected. In Kenya, families depend on land and forests for food, water, and firewood. Women in particular play a significant role in gardening and agriculture and collecting water and wood for their families. A healthy household is critical to properly managing these natural resources, and a healthy environment is critical for the health and well-being of families. However, many development challenges threaten the well-being of families throughout Kenya. Deforestation is a major problem despite many conservation achievements over the past decades. Population growth is also a concern. Families are having more children than they intend to have, which means natural resources have to be shared among more people. This problem is in part caused by inadequate use of family planning services. 1 out of 4 married women in Kenya want to delay their next pregnancy or avoid future childbearing completely, but are not using any family planning method. In response, the Greenbelt Movement and FHI 360 teamed up to address environmental and family planning challenges simultaneously.
When the women started saying that they did not have enough firewood, that's what gave me an idea. Why not plant trees? I asked the women. Let's plant trees. And the women said, well, we would plant trees, but we don't know how. And that started the whole story of, let's learn how to plant trees.
The late Professor Wangari Maathai founded the Green Belt Movement, or GBM, in Kenya in 1977. GBM is an environmental organization that empowers communities, particularly women, to protect the environment and improve livelihoods. Through their cadre of green volunteers and tree nursery groups, GBM has planted more than 51 million trees in Kenya since it was founded. In 2010, GBM partnered with FHI 360, a global health and development organization, through funding from the United States Agency for International Development under the Progress Project. FHI 360 and GBM developed an integrated population, health, and environment, or PHE project. The PHE approach is particularly suitable for areas where growth and migration place pressure on the environment, where degraded natural resources affect health and livelihoods, and where poor health services threaten sustainable development. GBM's Green Volunteers are environmental conservation volunteers who work throughout Kenya to establish tree nurseries and plant seedlings on private farms, public lands, and in degraded forest watersheds. FHI 360 and GBM trained 43 green volunteers to discuss the relationship between population, health, and the environment. They learned to share messages about the benefits of family planning and the range of family planning methods available in Kenya.
Through the PHE project, the community was able to see the linkages between population, health, and environment. If you support one aspect, the population, again you support the environment, because the same people who are looking after the environment, they need them to be healthy.
With the aid of specially designed flipbooks and other materials, the Green Volunteers talk about the importance of healthy timing and spacing of pregnancies and how population and health affect the environment. They explain that when couples have the number of children they can care for, they protect the well-being of the family. Smaller families have lower demands for natural resources like water and firewood. Women also have more time to devote to activities to protect the environment, like tree planting and activities like gardening, which can improve family nutrition and generate income.
Naona inaingiana sababu saa ile tunapanda miti, tunafanya spacing. Na tukifanya spacing miti inakuwa strong. Vile vile kwa watoto, Watoto tukifanya spacing, kuna stress, watoto wanakuwa vizuri.
Nikizaa haraka nipate watoto wengi, sitapata ile nafasi nzuri ya kwenda kupanda miti na hata kutengeneza hiyo kitchen garden. Hata time ya kulima sitapata, taharibu mazingira.
The PHE program has been very useful to the community groups that we've been working with through our broad networks from the GBM that have been in Nithi, that is found in Eastern Province of Kenya, and in the Central Province of Kenya. Basically communities that live around very important natural resources, which are two of Kenya's greatest water towers, that is Mount Kenya and the Abadias Forest. The community around here totally depends on the forest services such as water, rain, the biodiversity services offered such as firewood. They'll go for fuel wood into the forest, and therefore increase of populations around these fragile or vulnerable water towers becomes a risk towards their livelihoods and their well-being.
The Green Volunteers do not distribute family planning methods, but they make an important contribution by strengthening links to existing government-supported family planning services. They do this in 3 ways. First, they organize community meetings with community health extension workers who provide complete information about family planning options.
Kazi ile iko waendelee kuambiwa, maana kuna wengine hawajui what is family planning na wako huko.
Second, the Green Volunteers reinforce PHE and family planning messages at community events organized for other purposes. Third, Green Volunteers encourage community members who want more family planning information or services to go to health facilities to obtain counseling and methods.
PHE component with the Green Belt movement was very meaningful and very appropriate even to the government, because, for example, in the areas where PHE was tackled in Kenya, you'll find that the community was more empowered with information on population, with information on health, as well as environment.
Hii elimu ni muhimu kwa jamii kwa sababu inaweza kuwafaidi zaidi. Hata kukaa nyumbani na njia mzuri na hata watoto kufurahia malezi ya wazazi wao.
FHI 360 conducted a study to assess the effectiveness of this pilot PHE intervention. And one of the key objectives of this assessment was to find out whether these Green Volunteers would actually be able to retain the basic family planning information that they were given during their training, and also to be able to pass on the same information to their communities. So the results are very positive. They show that indeed the Green Volunteers were able to retain this basic information on family planning, as well as to explain the links between population, health and environment. And in turn, when we talked to the community members, we found that the same information was able to really resonate with the community members. They had the similar basic information on family planning, and they were also able to explain the links between population, health and environment.
Further, it appeared that one of the major benefits of the intervention was to combat myths and reduce misconceptions about the dangers of modern family planning methods that detract from their use. This approach was also beneficial for reaching audiences that traditionally are not exposed to information on family planning, mainly men. While more research is needed to evaluate the impact of the GBM intervention, the results are encouraging and contribute to the global PHE experience, which shows many potential benefits to this integrated approach. The environmental community needs to talk with donors and policymakers about the benefits of PHE projects and explore collaboration opportunities with health organizations. We also need to advocate for resources to conduct rigorous evaluations of the benefits of these projects to support greater investment in integrated services. PHE makes sense. We need to do more in this area for our health, for our environment, and for our future.